Hey y'all, real quick. I just wanted to make a quick video because I had to go drop my boyfriend back at the hospital today, right? These niggas, oh my god, this is why it is so important, y'all, for y'all to start reading and doing shit on your own and not just trusting these doctors and fucking ERs and hospitals and shit. Okay, I went in there and because he went into the hospital while I was on vacation, right? And so said he was feeling fine. He came out and he went back in. And remember, I told y'all this. He has issues with his teeth. Okay, and the mercury filled amalgams that's in his mouth. Okay, I made that a couple of videos back. Y'all all actually need to go watch that video because there's a lot of useful information in that video. But yeah. So anyways, I dropped him off this morning and I'm telling her, like, he was just in here. It's just literally the same thing. There's not no fucking COVID and none of this shit. I told her, I said right before quarantine, he was actually supposed to undergo a mercury test through his dentist, and also get his root canal checked because a lot of root canals after a few years or so can get infected, you know, because pretty much they're drilling in your mouth. Okay, so I'm telling her this, so she replies right after I said, this is why when you guys keep taking the blood test, you guys find a high white blood count, but you don't actually see anything in his CAT scan because you're only CAT scanning his stomach. I said the problem is in his mouth. You know what I'm saying? I was like, the infection is in his mouth. Okay, and so she was like, so you're telling me that he has an infection in his mouth, but the pain is in his stomach? Are you fucking kidding me right now? What the fuck kind of doctor does not know that the mouth is directly connected to the digestion? Like, that's literally the only place anything in your mouth can actually go is to the fucking stomach first. Like, that's the first fucking thing that it hits. I'm mad as shit that I had to explain this fucking process to a fucking person who works around patients. These people are working on y'all. Are you fucking kidding me right now? I told her, I said, ma'am, if y'all have never looked at his mouth, right? Even though I told y'all to look at his mouth a long time ago, right? And this process of fixing this has been blocked since quarantine has started because they're not seeing anybody except to remove teeth. Okay, this is beyond the removing teeth issue. Okay, he has a lot of things that they gotta go in his mouth and do, so he has to wait. This is why he's ended up back into the ER. I said that's number one. I said number two, if somebody has an infection in their fucking mouth, okay, which you guys find every time you draw his blood, so I know it's there. Okay, you can look in his mouth and tell that something's going on. So I'm like, so if I'm telling you that the amalgams that you doctors, okay, recommended to have removed years ago, right, are still in his fucking mouth, I said they're gonna leak mercury into his fucking blood. It's gonna leach into his blood. Okay, the vapors, whatever the fuck is falling out of his mouth as has his tooth cracked when his wisdom tooth came in and all this other shit. I said the amalgams are right there. So if his teeth cracked, it's going to be leaking mercury vapors. This is getting into his blood. What does the blood do? The blood circulates throughout his body. That's why the pain can be anywhere. Okay, through his internal organs, because it's literally it's leaving his mouth, going through the digestive system, and then getting into the fucking blood. Okay, like what the fuck do you not understand about that? How are you working there and don't understand that the mouth is directly connected to fucking digestion? Every foreign doctor knows this. Matter of fact, in other foreign countries, when you have a fucking stomach issue, that the first thing that they do is check your goddamn mouth, because they know. We would go ahead and get that shit out of the way right away. We would eliminate this as an issue. Okay? Then we could go ahead and start testing you for other shit like autoimmune diseases and family 23andMe and all this other bullshit. Genetic disorders and all this other shit. But can we get the basics out of the fucking way? The fact that they don't even understand how the body works is fucking ridiculous. Y'all are letting people practice. Why do y'all think I call it a doctor's practice, medical practice, family practice? They're fucking practicing on y'all. This is not a no. They don't know. You're a fucking trial experiment every time you get in their hands. You know what I'm saying? The best thing that these niggas do is surgery and fucking pain management. That's literally all that the fucking hospital should be used for. Because outside of that, they don't know anything. And she did not refute me in the fucking hospital either. She just turned around and started doing her fucking job. She was like, oh, okay, well, we can't do a mercury test in here in the ER room. That's interesting. Why can't they do a mercury test in there. Because what? They don't have all the hazmat gear? If you're in an emergency room, shouldn't you have that? All the gear is necessary to you, because you never know what type of test you may actually have to take. What if a little kid was playing with one of those old school thermometers and shit and got the mercury all on their hands and shit? How would y'all treat that person? Because the parents are going to take them to the ER room. So now I'm suspect. Okay? Fuck, man. Y'all know it was serious because I came on without even doing my eyebrows this morning. Like, it's early too. Like, this is fucking ridiculous. Y'all better watch who y'all taking y'all bodies to. Y'all better watch these practices. Y'all better watch these doctors. Y'all better go get second opinions on shit. Y'all better start researching and understanding how your own fucking body works so you can go ahead and know when a doctor is full of shit and refute this shit. So you at least even know when you're hearing bullshit to go get a second opinion. Come on, y'all. Come on. Come on, doctors. I'm gonna need y'all niggas to go ahead and take an initiative like some other doctors do and take these fucking nutrition classes. I'm gonna need y'all to take biology classes. Apparently, y'all niggas don't understand what the fuck is happening. The hell you gonna ask me if something's happening in his mouth? Why is it happening in his stomach? This is just like what happened with my mother with when she was having the fibroids and it put her in the hospital. She kept waking up with her arm was numb in the morning, every fucking morning. Right, so she thought something was wrong. She was having like some type of stroke or some shit. She said she didn't start to feel better usually until she got up, like physically stood up and moved around, and then her arm would go back to normal. Right. So then I asked her about her fibroids. I said, so, can you feel your fibroids? She said, yeah, I can feel my fibroids. Sometimes I feel like it moves. That's why I think I need to go see somebody for it, because I feel like it's big enough that it's moving and shit, or it's laying on shit, like AKA laying on her fucking nerves, because she likes to lay on her back. Your uterus is not that far away from your goddamn spine. Okay? Matter of fact, no matter what it is. Okay? If you have a benign tumor inside of your fucking body, if it gets big enough, eventually it's going to start laying on veins. Okay? If it starts to lay on veins, eventually someplace throughout the body is going to be affected because the pressure is not going to be the same because it's affected by the tumor laying on it. Okay? Thus, that is why when she would go to sleep at night, her arm would go numb because the tumor would move, lay on a nerve and a vein and fuck up her blood flow, and it didn't feel better. So she stood up where the fibroid can now move off the fucking veins and shit, where her blood can start flowing again, especially because she's moving around now. Okay? She goes to the fucking ER. They sent her to a neurologist. I'm like, why is she going to the fucking neurologist? She needs to go to the fucking OBGYN people, the gynecologist. Okay, not the OBGYN, that's for pregnant people, I'm sorry. But she needs to go to the fucking gynecologist because they need to be taking a look at this fucking fibroid. That's what they need to be taking out. Not the fuck. Why are they looking at the shit in her arm? Nothing has happened to her fucking arm, okay? She hasn't gotten a cut. She ain't fall on it. Ain't nothing fall on her. None of this shit. She's had no injuries to her arm. Listen to what the fuck I'm telling. I had to pull the nurse out. She got me so fucking mad. I had to pull the nurse out. I said, ma'am. I said, please make it make sense. I said, so I'm going to give you an analogy. You tell me if you understand. I said, if you take a hose and you start watering your garden, and I go in the backyard and I step on the hose where you can't see me, okay? But you're still trying to water your garden, and all of a sudden you feel your water pressure getting low, and you're wondering what the fuck is going on because you don't see anything, right? You don't see anything. You didn't adjust the water, but somehow your water pressure is lower because I'm in the fucking backyard standing on the fucking hose, affecting your pressure. Think this is the same thing occurring inside of her body. This is why I keep sending her to the neurologist, and they keep sending her ass home so when they don't see it, there's nothing wrong with her arm. Because it ain't a fucking arm. Her whole body. What the fuck is wrong with you American doctors and this allopathic medicine view of the body? You guys fractionate the body. The body's a fucking whole. Whatever the fuck happens here, happens here. Whatever happens over here, happens over here. That's why if you fall on the fucking back of your head, you fuck your eyes up. Like, your division's in the back of your fucking head. Not here. Like, how the fuck do you guys think you're gonna solve anything by fractionating the fucking body? It is a whole. This is why we got 8,000 bills for fucking hospitals. Because each of y'all want to treat one body part. What the fuck is wrong with you? You need a whole. You need a whole. You need a whole doctor. That's why holistic doctors is fucking on the rise right now, because they the only ones to understand the body is a whole. They're the only ones that understand it's a fucking eternal being also. You have to address the spiritual. What the fuck is going on with these people? They could be eating right. They could be eating perfectly. If they have a shit ton of stuff going on in their life, okay? If they have stress, if they have trauma, PTSD also, that's going to affect their health no matter how fucking good that they're eating, because it's a hormone imbalance. The fuck? Damn, I'm so mad. I'm sorry. I just, if y'all don't understand how serious this is, I don't know how to make it any more serious for you. Like, you need to know how your body works so you can know when you're being conned and when you're being told some bullshit, so you know when to go get a second opinion, so you know when you're actually around the vicinity of people who actually may actually give a fuck about your health, because there are some out there. But goddamn if you ain't got to go through a haystack to find the needle, don't you? Peace.